All right. What is diabetes mellitus type 2 or DM2? Well, I like to think of it as a chronic state of hyperglycemia due to the development of insulin resistance. And what does that mean? That means that you're consistently experiencing a high amount of blood sugar. So the sugar that's in your blood over time, and that's due to your body's inability or inadequacy to remove that blood sugar. And so, how is it diagnosed? Well, there's a way to look at numbers, and A1C is a lab test that's going to tell you the past 3 months average of what your blood glucose has been. So A1C greater than or equal to 6.5% is going to put you in the DMT2 category, and fasting blood glucose, where you fast overnight, go into the doctor, they draw your blood, anything that's 126 or over in milligrams per deciliter is going to mean that you have diabetes. So like I said, that A1C is the average over 3 months of what that blood glucose number has been. So what do we see in DMT2 individuals? Well, the signs and symptoms are increased risk for infection. So we see a lot of infections due to the increased inflammation in the body and the decreased immune system. We'll see increased urination, appetite, and thirst. And then other symptoms may be present, but that's usually going to come from advanced complications that are from related issues that can develop from DMT2. And so the risk factors are body mass index of greater than or equal to 25, a sedentary lifestyle. We see that hypertension and dyslipidemia, so abnormal cholesterol and fat in the blood and the body is dyslipidemia, and then hypertension's that elevated blood pressure. And then we have polycystic ovarian syndrome in women. Some complications that could happen with DMT2 is diabetic retinopathy. So you're going to see the damage in the neurons and the cells in the eyes. Diabetic nephropathy is the cellular and neural damage in the kidneys. And we're likely to see stroke or the development of cardiovascular disease. And then neuropathy is that cellular and neuronal damage, typically within the extremities. We have the mechanism, but I'm going to save that. I'm going to go over that last. I want to draw, kind of go into it a little bit deeper. And then what do we have for treatment? So the best ways to approach DMT2 is to increase physical activity. It's a good idea to do it slowly because during treatment, when you're in a diabetic state, your body's in overdrive. It's producing a lot of insulin to manage the blood sugar that's there. So if you go exercise, you're likely to remove that blood sugar, and your body's working hard to remove it already, and you can experience low blood sugar. So you can get tired, shaky, pass out, and especially if you're also on medications that increase insulin sensitivity. Now, diet is the number one way to approach treating diabetes because diet's typically how we got there in the first place. There are a lot of methods to treat with the diet, but I want to go over that in another video because it's so extensive. And this is just a superficial overview of DMT2. Now, the next step is medical treatment. The first line of defense is going to be a medication that's going to increase insulin sensitivity, such as metformin. And then later on, at the point where metformin is not working, you're likely to see insulin therapy implemented, which is taking insulin as a medication and injecting it into the body to help remove the blood sugar in your body. Now, the goals. So the goals of treatment of diabetes is to correct the presence of metabolic syndrome. And blood pressure is one way, or one of the symptoms that you want to correct. So in decreasing blood pressure and then correcting any abnormalities in the cholesterol in the body. It's a good idea to monitor the eyes for vision changes, feet by checking, like you can have a friend or your spouse scratch or poke your feet to make sure you're feeling it, because your feet are supposed to tell you if you stepped on a Lego, and if there's that neuropathy being experienced in the feet, you might not feel anything, and that's why you see a lot of patients get to the point where they need to have a amputation of that foot or leg. And then the kidneys. So the way the kidneys are monitored are through blood labs or urine labs, and the way to kind of control the progression of any issues with the kidneys is to decrease that blood pressure and decrease weight, because that takes that extra stress off the kidneys. So the prognosis, what is the outlook for treating DMT2? Well, it's going to rely mostly on your lifestyle changes, and dependent on how much effort you put in making the appropriate lifestyle changes is going to dictate how you overcome DMT2. Because the more effort you put in, the more positive changes you make, you're more likely going to see a remission of DMT2. But if you don't manage, or it's poorly managed, you're going to see an increased progression. You're going to see an increased rate of disease progression. And medications may no longer work. But the idea is to slowly implement lifestyle changes that are going to help you get back to a point where you don't need that medication anymore. All right, so let's discuss the mechanism. Now, I hope I don't get in trouble for using this picture. It's not mine. But this shows some statistics and the organs that I was discussing that are affected by complications with DMT2. But let's discuss what happens, the process, the mechanism. How do we get DMT2? How does it develop? Well, let's say we're having some pizza, right? And that pizza is going in our mouth, goes in the GI tract, comes down to the stomach, goes through our digestive tract, and let's see. Let's use this green. This is going to be that sugar, right? So the stomach breaks down that pizza, and then we have in our intestines where it's getting broken down even more and absorbed into the body. And as it gets absorbed into the body, now it's going to be in our blood vessels. So this is all sugar, right? So it's all this green stuff is the blood sugar spreading throughout our body. Well, we have what's called the pancreas. And the pancreas sits over here. Whoa, why did I do that? Okay. And that's it has what are called beta cells. And those beta cells produce and release that insulin. So let's say this yellow is that insulin. And what that does is that goes in our bloodstream, picks up that blood sugar, and shuttles it into the cells throughout our body. So we have different cells. Let's take this. Let's do blue. Okay, down here. So we have these cells, right? And this could be your muscle cells, your fat cells, and those cells want to uptake that blood sugar, and your insulin is what's going to aid in that process. So we have the insulin circulating. So remember, this is the cell. Insulin, what color? Okay, I used yellow for insulin. Okay, here we go. Here's that insulin, and it's got that glucose with it, right? But what this wants to do is it wants to fit into here like a puzzle piece. And that's the normal function of a cell with the insulin. It wants to pick that up. And now keep in mind, these cells have these like all over. It's not just one. It's going to be able to uptake and interact with multiple units of the insulin hormone. But when it gets overwhelmed, when we see the body start to develop the diabetic state and that insulin resistance, the body is having a lot of this blood sugar, right? So the increased amount, when you have a lot of blood sugar all the time, these cells get stressed out. They're working overtime. they're getting, you know, pumped up in size because they're intaking so much sugar that they can become damaged. They want to change, they want to adapt. And what they do is they can either get bigger. So now it's like bigger, taking in tons of insulin. So that way you have a bunch, or you can have it down regulate. And we tend to see these receptors. So imagine this is the receptor. It's going to close up. It's going to get sucked inside, right? So now it doesn't have as many. So like maybe you had multiple, right? But now you only have two. But you have tons and tons of insulin. And so even when this is still, this muscle or fat cell is still functioning, it's not functioning efficiently. You can only handle a couple at a time, right? Wrong color. So it's only able to handle a couple of these insulin cells at a time. So that's what we see when we see the damaged cells in our body down-regulating or adapting to the overwhelming the consistent overwhelming amount of blood sugar in the body. Now, the other damage that we can see is in the pancreas. So those beta cells, right? The beta cells are what are producing that insulin, but when they're getting overworked and chronically working harder, when we in the first stages or in pre-diabetes, the pancreas is able to handle that increased stress when these aren't working, when these cells are not working properly. The pancreas is going to increase the amount of insulin it secretes. But over time, when it's constantly overworked and producing all that insulin, it's going to get tired. You can start to see dysfunction in those beta cells, and now the beta cells are no longer producing insulin at an adequate rate for the body. And so we see the development of all of this sugar in the bloodstream, and it's not getting put back into the body or into the cells. And sugar as a molecule is a sharp and damaging substrate. So what we see is in these cells throughout the body, so like we've discussed the neuropathy, nephropathy, retinopathy, what it's doing is it's damaging those organs. So as it runs through the vessels that run through those organs, it damages those vessels, those cells. You see scarring, and the inflammation increases. And because, the body's got to deal with that damage. And that damage is what's going to lead to those issues. And that's why it's good to keep the blood sugar under control, because you don't want too much going around damaging the body. So what are some methods that we can do that through the diet? Let's see, clear page. Well, that's not what I wanted. Okay, so a lot of different methods, a lot of different nutrients that are going to contribute, but physical activity is, let's start with that first. Physical activity, what that does is when your muscles are working, it's utilizing the carbohydrates that are in your body. So let's say you go for a run, a walk, you do some squats. Now it's utilizing this blood sugar. It's emptying it out from the bloodstream. So that way now you have more room to consume blood sugar and not overwhelm the body. Another method is to kind of have portion control with carbohydrates. So you eat like one slice of pizza, you're going to get this much sugar, right? If you eat 2 slices of pizza, you get double that. Now, the body is going to release that insulin in response. But if you stick with that one slice, it's not an overwhelming amount of sugar in the body. And so your cells aren't getting as stressed out during that period. And so it's a good idea to slowly consume your carbs throughout the day, so that way you're not overwhelming the body. All right, I'm pretty sure that covers this superficial explanation of DMT2. And like I said, I will go over more diet information on how to treat diabetes in another video. All right. Thank you.